Thank you very much. Good afternoon, or or perhaps it's good morning or good evening. I'm not entirely sure. It's a virtual conference, but no matter what, I mean, even though this is a virtual meeting, my appreciation for the audience and for the organizers is very genuine and real. And at least part of it is because even though this is a conference that is mostly on wellness and health, they still had, they squeezed in a pill pusher like me to speak on a drug and a disease, diabetes. So I will be talking about some key aspects in diabetes prevention and management. Those are my major disclosures. I'm kind of a pill pusher, but then I'll ease into that role. Okay, so the learning objectives are: we'll start with trying to gain some insight into diabetes prevention strategies, and then we will talk about two categories of drugs today: the SGLT2 inhibitors and the GLP-1 analogs, and understand their role in the treatment of patients with diabetes. All right, so this is clearly not the most appetizing apple you've seen, okay? But then again, I mean, that's not simply because I am a pill pusher and I'm showing this, but I know you are, the message is quite clear. I mean, the reason I put this is because this is the only one that would get past the copyright police, but all other beautiful ones had to be copyrighted. So this really doesn't need any great elaboration. We know that healthy lifestyles help prevent diabetes. And there was no study which showed this better than the diabetes prevention program. This is now almost 20 years old. So just to jog your memory, so this was a large-scale randomized clinical trial, involved more than 3,000 patients. They wanted to see whether lifestyle intervention and pharmacological intervention were effective in either preventing or delaying the onset of diabetes in patients who are at high risk. It was a very intensive trial, in the sense it was not just about giving them a brochure or referring them to a website. There were individual case managers who handed out these individualized toolbox of adherence strategies. So very well done, and then it had very concrete, clearly defined goals. So all subjects would do at least greater than 150 minutes per week of moderate intensity physical activity. There was a goal for weight loss equal to or greater than 7%. And having done all this, what did they achieve? So the primary outcome was the change in diabetes incidence. So this is the incidence of diabetes per 100 patient years. So this is the incidence in the placebo group across different fasting plasma glucose levels, different BMIs, age categories, and whether there was gestational diabetes or not. And when compared to the incidence in the placebo, so across all these different groups, there was nearly a 50% reduction. Overall, it was about a 60% reduction with the lifestyle intervention. So you probably are aware of this. And how does this compare with, say, metformin? Well, metformin was also not bad. It did decrease the incidence only in certain subgroups. And that was primarily those who already had a higher fasting plasma glucose or a higher glucose level overall. So if you looked at people with an A1C below 6%, metformin did nothing. It was only in people who were already closer to diabetes that there was some benefit of metformin, and perhaps in people with a higher BMI, like those over BMI over 35, and perhaps some other, you really had to kind of slice it many ways to look at some benefit of metformin. And there were many patient subgroups where metformin really was no better than a placebo. Whereas on the other hand, lifestyle across all these different groups was clearly effective in preventing diabetes.